The story of cousin marriage in the United Kingdom is not one of black and white, but of deep shades of culture, science, ethics, and identity. For generations, families across Britain, particularly within South Asian, Middle Eastern, and traveller communities, have maintained cousin marriages as a tradition rooted in kinship, trust, and continuity. Yet, as modern science reveals the potential genetic risks and policymakers begin to question these customs, a complex debate emerges, one that tests the nation's values of freedom, diversity, and social responsibility. The issue re-entered the spotlight when, in late 2024, the Marriage Prohibited Degrees of Relationship Bill was introduced in Parliament. It proposed to outlaw marriage between first cousins, a move framed as a health and human rights measure to reduce the incidence of congenital disorders and to empower women within traditional family systems. Advocates presented it as a safeguard for public health and female autonomy. But opponents warned that it risked stigmatizing entire communities and undermining personal freedoms in a way inconsistent with Britain's pluralistic character. Behind the political noise lies a question as old as governance itself. How far should the state go in regulating private choices when public welfare is at stake? Scientists and policymakers alike turn to the data for answers. Genetic studies reveal that first cousins share around 12.5% of their genes. That shared ancestry increases the chances of both partners carrying the same rare recessive gene, which, when inherited in a double dose by a child, can cause illness. Statistically, this raises the likelihood of congenital anomalies from about 2 to 3% in unrelated couples to roughly 4 to 6% in first cousin couples. The risk in relative terms doubles, but in absolute terms it remains small. These numbers are important because they show nuance. While the risk exists, the majority of children born to cousin couples are healthy. Biomedical researchers, particularly through the Born in Bradford study, have mapped this reality over 2 decades. They've shown that genetic risks vary with family history, environmental factors, and access to healthcare. In communities where cousin marriage is practiced repeatedly over generations, the risk does grow, but education, prenatal screening, and counseling can significantly mitigate it. Sociologically, cousin marriage in the UK is not a widespread practice across the general population, but concentrated within specific groups, especially among British Pakistanis, some Bangladeshi families, and traveller communities. Within these groups, the practice has historical and cultural roots, often symbolising family unity, economic security, and trust. Yet even here, patterns are changing. Younger generations, particularly those educated and born in Britain, are increasingly choosing partners outside their extended families. Data from Bradford shows a significant decline in cousin marriages over the last 2 decades. Social norms, it appears, are evolving naturally through education and awareness, not through prohibition. This is where the ethical tension lies. Should the law intervene in what appears to be a naturally declining tradition? Legal scholars argue that marriage and family life fall within the heart of personal liberty, protected under both domestic and international human rights law. Restricting 2 consenting adults from marrying based on genetic proximity challenges the principles of autonomy and privacy. Critics warn that it could open the door to paternalism, where the state dictates who can love whom, justified by a moral or medical argument. The issue of discrimination cannot be ignored. Though the proposed law would appear neutral on its face, its real-world impact would fall heavily on a small number of ethnic and religious minorities. In a country already struggling with the politics of integration and identity, such legislation could deepen divides. it could alienate the very communities it aims to protect, fueling resentment and perceptions of cultural targeting. There are also concerns about enforcement. How would the government verify family relations without intrusive checks or genetic tests? Such a system could easily violate privacy and dignity. Worse, it might drive couples to marry unofficially through private or religious ceremonies, leaving women without legal protections. Others could cross borders to marry abroad, bypassing the law entirely. In the process, genuine public health objectives might be undermined, and trust between minority communities and the state eroded. Philosophers and ethicists raise another critical concern: the slippery slope of eugenics. When the state starts defining which unions are acceptable based on the potential health of offspring, it risks crossing into ethically dangerous territory. Such arguments once underpinned eugenic policies of the early 20th century. Modern liberal democracies must tread carefully to avoid repeating those mistakes under the guise of health protection. Globally, approaches to cousin marriage vary widely. Some nations, like parts of Scandinavia, have considered or implemented bans, but enforcement proved difficult and socially divisive. In the United States, laws differ from state to state. Some permit cousin marriage, others forbid it. But studies show that even where bans exist, the practice often continues informally. Conversely, countries that emphasize genetic counseling and education rather than criminalization tend to achieve better health outcomes without alienating communities. In Britain, public opinion remains divided. Surveys suggest many people support prohibition, often driven by concerns about child welfare and women's rights. Yet these opinions shift when people are presented with actual data showing the small absolute risk and the ethical complexity involved. Media framing plays a significant role in shaping this perception. Simplistic headlines can turn a medical nuance into a cultural controversy, perpetuating stereotypes about certain communities. Responsible journalism, therefore, requires sensitivity, presenting facts without fueling prejudice. Amidst the debate, experts propose a balanced way forward. Instead of prohibition, they recommend strengthening culturally competent genetic counseling and voluntary screening programs. These services would operate within communities, using interpreters and trusted local figures to provide information and guidance. Couples would receive accessible, non-judgmental advice about genetic risks before marriage or conception, enabling informed choice while preserving autonomy. A further step could involve requiring registrars to provide informational leaflets or brief counseling to cousin couples at the time of marriage registration. This simple measure would ensure awareness without coercion. At the same time, investment in community education, particularly through schools, women's groups, and religious institutions, could reshape norms gradually and respectfully. Over time, informed decisions, rather than imposed restrictions, would drive cultural change. Such an approach reflects a broader principle: that sustainable reform must be built on understanding, not punishment. Change that arises from within communities lasts longer than that imposed from above. And when individuals are empowered with knowledge, they often choose safer paths themselves. The debate also underscores a fundamental truth about modern Britain: its strength lies in its diversity. A pluralistic society cannot demand uniformity at the cost of liberty. The challenge is not to choose between health and freedom, but to reconcile them. A nuanced, rights-based public health strategy can achieve both. Policymakers are therefore urged to adopt a system of monitoring and evaluation, tracking health outcomes, participation in counseling, and social attitudes. If, after sustained voluntary measures, the data still show harm that cannot be mitigated, then stricter policies might be reconsidered. But such escalation must be evidence-based, transparent, and consistent with human rights principles. The statistics from Bradford and other regions show slow but steady change, declining cousin marriages, increasing education, and growing awareness. These natural shifts highlight the success of cultural dialogue and healthcare collaboration. They show that progress is already underway without legal coercion. The controversy, then, is not really about science, but about values. It is about how a democratic society balances the collective good with individual freedom. It is about how public health policies intersect with culture, identity, and human dignity. One message stands clear. The goal is not to judge traditions, but to understand them. Not to impose solutions, but to create space for informed choices. Every society evolves, and with empathy and education, even the most sensitive issues can be addressed with fairness. Cousin marriage in the United Kingdom is more than a genetic question. It is a reflection of who we are as a nation, how we view difference, and how we balance compassion with caution. The most ethical path forward is one that preserves health without harming humanity. And in the end, the true measure of progress will not be the number of laws passed, but the number of conversations started. Conversations that replace suspicion with understanding, stigma with science, and division with dialogue.